Hello, this is Dr. Daniel Cameron, and I have the pleasure today of meeting an author, Jennifer Christie, and she's written a book that has come out called One Tick, Stop the Clock. Now, Jennifer is somebody I know quite well, and I've known her because she's interviewed me a couple of times as part of the initiative by Global Lyme Alliance. That organization was interested in COVID, interested in long COVID, and based on Jennifer Crystal's experience, it certainly helped us initiate a dialogue, and that was a pleasure. So today, I wanted to talk to Jennifer in a different role as an author. So welcome, Jennifer, to the program.
Thank you so much, Dr. Crammon. It's great to see you again, and I so appreciate you having me.
Yeah, thank you so much, Jennifer. Now, you had sent out this book to me a few weeks ago, or it could be a couple months ago, as you went through the editing process. And it was fascinating for you to look back at your experience with Lyme disease and how you got to know Lyme disease. But I like, always going back in time to not say I've got it all figured out now, but how did it even dawn on me that I should look at Lyme disease and all the missteps and miscommunication? So tell me a little bit about that very beginning now that you reflect back on that time.
So reflecting back on the time, it's hard for me to believe, knowing what we know now, that Lyme disease wasn't considered right away. I was working at a summer camp in Maine. I was 19. It was 1997, and I found a rash on my arm. It wasn't a bullseye rash. It was a splotchy red rash. But at the time, Lyme wasn't really on our radar, even in the woods of Maine. Even me being originally from Connecticut. Um, and I didn't know at the time that, first of all, that not everyone even gets a rash, and but that it doesn't have to be a bullseye. Also, that a splotchy red rash or a different type of red rash could be indicative of Lyme. And the camp nurse at that time, she was from England, so she, really wasn't thinking Lyme disease. She was very well versed in the, other things that would go on at camp. But she looked at the rash and said, "Well, it doesn't itch. You said it doesn't itch, doesn't hurt. Let's not worry about it. We're at camp." And I felt the same way. Like, all right, could be anything. And then later that summer, I developed hypoglycemia, just seemingly out of the blue. And we never, related the two. And then that fall, when I went back to school, I had a terrible flu-like symptoms. And again, nothing was ever put together until much later. And I do think with Lyme literacy improving, that if that was today, and I presented with all that, particularly with the rash, my hope is that, Lyme would be more on the radar and would be considered with all of those symptoms. Um, but it was, many, many years. It was 8 years after that, when, someone started to finally put all the symptoms together, and trace them back to that original rash.
Let me
Um,
interrupt you for a second because that goal and that hope of being recognized early hasn't really improved in patients that I've seen. I
mm,
continue to see people in 2024 who have been diagnosed with hypoglycemia or some other diagnosis, and there's each diagnosis seems to be reasonable, but Lyme disease doesn't come up in the conversation, or it might even come up in the conversation is they don't know what it is, they just know it's not Lyme disease.
mm, mm.
And that's so I just want to interrupt you and tell you that I wish it was better. There are professionals out there who recognize it earlier, but not enough. So I always see people that have fallen through the cracks. That's why it was fascinating to go back to that discovery process. So let me go ahead with that discovery process.
Yeah, that is, certainly disheartening to hear that there are still so many stories out there like this, like mine. There are too many, and we certainly need to get the word out more and more so more physicians can recognize Lyme and other tick-borne illnesses earlier. For me, for the discovery process, so I was diagnosed with Epstein-Barr virus, which was correct. I was diagnosed with that in 2003. I had a case of mono that my body could not fight because I had underlying tick-borne illness that we didn't know about. And so that slipped into chronic active Epstein-Barr virus, which I was diagnosed with and was totally bedridden for 2 years, with symptoms that just kept getting worse. And no one considered was there an underlying infection? Was there, anything else going on, myself included? So the day that all changed is I was blow drying my hair, which was a strange thing for me to be doing at that time because I didn't go many places and I didn't have a lot of energy. So I had very, very little energy. So something like blow drying my hair took a lot of effort. But perhaps I was, meeting a friend for lunch. For whatever reason that day, I was blow drying my hair. And as I was doing so, my elbows were up, right? So I could, going like this, and I could see in the mirror two bullseye rashes on either elbow. And I had gotten to the point in my own medical trajectory where I, was used to doctors writing off my symptoms, and I started to do the same myself. So I was seeing a naturopathic physician at the time, and I said, I don't know, maybe I was just like leaning on my elbows funny. And he said, no, that looks like the bullseye rashes of Lyme disease, which can show up, much later than a tick bite, or you can also, get reinfected is another possibility. And so he said, I really think you need to go see a Lyme doctor. And that's what I did. I went to, see a Lyme physician and was tested. And I had previously been tested once, not knowing how faulty tests were, not knowing that there's a two-tier process. So I'd only gone through the first tier, which was negative. And so this went through the two steps of a Western blot test, which was kind of a CDC positive result for Lyme disease. It was also positive for babesiosis and ehrlichiosis. And that's when the journey sort of ended in terms of, the quest for diagnosis, but began in terms of, I sort of thought once I got diagnosed, that would be it. Great. It'll be, easy to treat and I'll move along. And that
Yeah,
wasn't the case.
that that it commonly happens that somebody out of nowhere finally pieces together unrelated things. So it was certainly beginning to have this integrative medicine doctor. Was it integrative medicine?
Naturopathic physician, yeah.
Naturopathic who said that, hey, all of these symptoms add up. They're quite aware of the whole constellation of Lyme disease symptoms, aware of what happens to the body, the whole immune response, everything that's about it. And but I always find that if there's an infection, that why not look and see if there's a tick-borne infection underneath it? And
Mhm.
it turned out that by being pointed in that the right direction, you not only had Lyme, but you had other co-infections. Babesia is, of course, emerging as a particularly frustrating infection. Back then, I think it wasn't talked about as much as it is now. So go ahead with the story of it didn't go as smooth as you'd like after that, just having the right diagnosis.
Yeah. So, and yeah, I had never heard of babesia. I had never heard of Ehrlichia. These were foreign words to me. So, that was quite an education right away that there are other tick-borne illnesses that, can be caused by the same tick bite that have different symptoms, different etymology that, and require different treatment. And, certainly can complicate treatment. So that was quite an education for me. So yeah, I have this scene in the book where I, want to get up on the rooftops and say, "Hey world, I have Lyme disease," because I figure that's going to be it. Now we're going to do antibiotics and I'll be better. But I started oral antibiotics, pretty quickly had a Herxheimer reaction, which my doctor told me was great because it meant that the treatment was working, and to stay the course. But we eventually decided to go on intravenous antibiotics, which I did for 9 months and got a lot better, considerably better, and also treated the babesia with anti-malarial medication. So we got so well that we stopped treatment entirely. And I, not yet sort of understanding what a chronic illness is and the way that Lyme can lie dormant and be a relapsing illness, I sort of thought I was done. I was not, back to the life that I had previously been living, but I was much better. And I, just sort of thought I was wiping my hands with Lyme disease and moving along with my life. And I dove right back into work and to moving out on my own. And that all proved to be way too much, way too fast, without any defense in my system. And within 3 months, I relapsed completely and had to start treatment all over again, back to ground zero. And at that point is when I really needed to learn, okay, what does it mean to have a chronic illness? And, what there are things that I can't control about what the infection is doing in my body, but there are also things that I can control in terms of how I pace myself and how I manage my life and how I take care of myself, that can help me not have these huge flares, these huge, dips and valleys, and maintain remission, with only minor flares. And I have thankfully been able to do that now for over a decade. But the actual journey to get to that point, was pretty much the whole second half of my 20s. I was bedridden, for at least 2 years of that, and then, doing well, and then totally back to bed for another year. So, I would say pretty much the whole second half of my 20s until I started to be able to live a pretty good life, with chronic illness, and have only improved since then.
Yeah, I think if I look at my patients who have not resolved the illness, they often will end up on a 1 to 10 scale,
Mhm.
maybe 8, which is like crappy, and 9, which is crappier, and 10, which is the crappiest. And so, with that kind of range, as soon as they can get past a 10 down to 8, 7, 6, life becomes bearable, but not near what they need to do. And so part of it is the quality of life, the missed opportunities to feel well. Also, it gets in the way of trying to move on with your life, with your career, with what you want to do, with your family. And so I would imagine during that time you had to make some adjustments to how you were functioning at the time in the up until what you're going to go into next. So you had some troubles?
I did. So when I first went into remission, thought I was doing well. I had been living in Connecticut with my parents, and I moved off to Vermont. I love to ski. I had formerly been a skier out in Colorado. I just kept talking about how I wanted to get back to that life, and get back to work. And I kept using the word back. And so that's what I did. And that was way too large a leap. And I ultimately, yeah, as I said, relapsed. But then, as I started to get well again, I realized I can't take that large of a leap because, as you said, like I've only come down from 10 to 7 or 6. I'm not at 1. I'm acting like I'm at 1, but it's very easily to move back to the 10, and you want to keep moving towards the 1. So, I took much smaller steps. I ended up just moving out on my own in Connecticut in the same town as my parents. So that they were nearby to help, that I could see all of my practitioners easily. I started, rather than diving right back into work, I started just doing a little bit of volunteer work just to see what is it like to be able to, give my time to something. Am I able to do that? So I started with that. Then I started doing some freelance writing work that was on my own schedule, started doing some tutoring. And so it was, it took a while to really build that up, build up my stamina, build up my capabilities in terms of work, in terms of social life, in terms of functioning on my own, and had to really learn to accept help that I couldn't do everything on my own, and be able to live and live healthily and not immediately relapse.
Just a
So
second.
that was a big
Why don't
adjustment.
I take a little slight interruption because for those who might have joined late, I just wanted to say that I didn't bring up. Of course, you can't see the book, I think, in Zoom, but it says "One Tick, Stop the Clock." So I'm here with Jennifer Christie. For those who are coming late, it's a memoir about her journey to from that rash, from different diagnoses, including Epstein-Barr and hypoglycemia, to where she had to modify her life expectations as symptoms go on. Now she's going to go to the next step. But I just wanted to reintroduce Jennifer, and thank you, Jennifer. So let's go ahead.
Thank you, Dr. Cameron. Great to be here. And hello to everyone. So yeah, so I was, I did all that in Connecticut. And ultimately, I started doing physical therapy and was doing better and better, was back on treatment, realizing that I had to be on treatment to, continue to get well, and modified that a bit, made lots of lifestyle changes, and ultimately got to a point where I was starting to actually get a little bored with my new life, and thinking, what's going to be next for me.
Oh,
Um,
question. is that
Yeah.
when you said that about treatment is that people think that once you get intravenous antibiotics that that's it, that there's no opportunities to get retreated, no opportunities to get a relapse. And so it's sounds like they held off, you held off on treatment. So you just mentioned treatment now. So does that mean you got back on antibiotics or just more symptomatic treatment?
And back on antibiotics. I never went back on a PICC line, but I restarted oral antibiotics, and I absolutely needed those to get myself back, including also nutritional supplements and adjunct therapies and physical therapy and lifestyle changes were all necessary, but I absolutely needed to retreat the infection um, and have stayed on a low dose of treatment ever since.
Yeah, I think there's always so much attention to NIH or at least some kind of double-blind randomized placebo-controlled study, but Lyme disease has been much more complicated than anybody really would like. You know, the NIH trials they were designed to try to answer the question of should you get treated or should you get retreated, but the only ones that seemed to sign up for those trials were sick for years. So
Mhm.
the Columbia trial, they were sick for 9 years, and they had already failed two previous treatments. So they were, at least they documented that people could be sick for years and fail treatment. And that study, the fatigue improved statistically significantly, even though it was only about 30 patients. The cognitive function improved temporarily. And
Mhm.
so that was not the end of the story. And
Mhm.
so in this case is that it's going to be hard to solve all the issues you're talking about with a simple NIH sponsored clinical trial. And so we're left in practice with these complex, involuted stories. That's why, even though I've been in practice, is that watching you go through this journey of discovery and misadventures was that's why this book is rather interesting. So let's get back to your story again.
Sure. Yeah. So, in Connecticut, so one day I went to the library. I was checking out a movie that someone had recommended, which is another strange thing for me to do because of my neurological, overwhelm from Lyme disease. I didn't watch a lot of movies, but I don't even remember what the movie was. But I went to go check it out from the library. And this is back in the old school days when they would hand you a physical paper, a call slip of what you had checked out. And on this piece of paper, which was the wrong call slip, not mine, it said Life Disrupted, Dealing with Chronic Illness in Your 20s and 30s by Laurie Edwards. And I was like, what is this? What is this book? So I checked out that book and, found it to be so inspirational, exactly the guidelines that I needed. Lori herself deals with a completely different chronic illness, but had struggled with many of the same challenges that I had of, losing independence and trying to regain independence. Um, being misunderstood by doctors and having to fight for diagnosis and validation, going through ups and downs of flares, dealing with the social implications of chronic illness when you're at a point in life when otherwise should be thriving. All of these things. And I learned so much from the book. And I saw that Laurie was a writer, that she had gone to graduate school for creative writing to write and written this book, and that she was teaching and living in the Boston area. And I really felt like, if she can do it, maybe I can. And so I contacted Lori, and that turned out to be serendipitous as well because she said, "Oh, I'm so glad you wrote to me. I've been looking for a Lyme patient to interview for my next book, in the Kingdom of the Sick." And so she ended up interviewing me for a chapter of that book. And again, I just really inspired what she had been able to do. And I guess you could say the rest, as you say, is history, as I ended up applying to the same graduate school program that she went to in Boston at Emerson College and going to get my MFA in creative writing and was capable of doing that. It was, having taken that long layover in Connecticut near my parents, getting myself back slowly, that I was able to take that next step, still with lifestyle accommodations. And go to graduate school and begin writing one tick stopped the clock, and it went on from there.
Yeah, I think that Lyme disease affects processing And it ends up sometimes with what's called the brain fog, and it seems interwoven through the years in addition to some of the other symptoms. So, but I always encourage people to stay on tracks because that doesn't mean they not processing very well doesn't mean they can't get focused. If they improve their health, they can get focused. So I have a lot of people who eventually do well. Kids especially, is that they often will stay in school just to try to get through their education. And if they can get the Lyme under control, they're at least up to grade level or up to college level so they can continue to pursue those plans. So that's why I see it all the time that at some point those dreams of that they have, including being in your case a writer, uh, came and bore fruit. So that's why it's exciting to hear you be able to take this as one of your biggest projects at this time and write this book.
And I have to say, just to go off that, just to let readers know, I know I'm doing, or, viewers know I'm doing so well now. You can see that, you can hear that, you can see it. I wrote this book, but there were times when I could not hold a pen. It was, too physically difficult. It hurt too much to hold a pen, where I had such severe brain fog. I could not watch TV. I could not write a paragraph. I could not read a paragraph in a simple magazine, and concentrate on it and know what I had read. Um, and I've worked up to this point where I am now, and all that I can do now, and all that I can write. So just to let people know that, like, I know what it feels like to have that brain fog, to feel like you are never going to achieve your dreams that you once had, and you're never going to be able to do any of this again. And if someone had told me at that time that I would someday, be able to write a book and, be on the other side and be teaching as well, and I would have laughed. I said, there's absolutely no way possible. And it became possible. It really became possible. It took a long time. And, I went to grad school much later in life than I originally thought I would be, and ultimately realized this dream, actualized this dream of becoming a writer in a much different way than I expected it to happen. But it did happen. And I do feel like, yeah, I still ended up doing exactly what I was meant to do. It just was a very winding road to get there.
Yeah, I recently shared a story in one of my blogs on a grandmother that ran into me in the airport in Washington, where, her daughter had been quite sick. She had been under my care. She had been on intravenous therapy, was doing poorly and attending school, and was fearful that she wasn't going to be able to achieve her life plans. But after treatment, the grandmother said that she did finish high school, finished college. She went on and got married, finished her nursing program, and was working in an intensive care unit. Also, she had two children, which would
Wow.
be the two grandchildren for someone who was talking to me. And so when she saw me, she couldn't help but share that for her daughter, so it worked out, and she has two beautiful grandkids. And so I just think there's always stories that are like yours, that you look back and think there's a lot of trouble, but there's also successes. They hardly ever get talked about enough. So that's why this book, One Tick Stopped the Clock, shows you where you took a path, but are getting some successes right now that it's a blessing.
It really is. It really is. And my clock was the clock of my life was stopped so long by a tick, but it is going again. It is very much going again, and it's wonderful to hear other stories like that. And I'm sure it must be heartening for you. I mean, without you wonderful Lyme physicians, none of us would get to the point that we are today. That's just not possible. I know that I got well because I had access to good treatment. And I know you've helped a lot of people along that road. And that's what patients need are Lyme literate doctors who really understand the complexities of all tick-borne illness, and are willing to stick with a patient along the long journey, and recognize that, especially for those of us who are diagnosed late, or how are or our cases are complicated by co-infections that, a quick round of antibiotics isn't going to do it. And so we need physicians who understand that and are going to, see us through until we are able to thrive in the context of our illnesses.
I know that you've been giving back by working with the Global Lyme Alliance. They've been working to try to advance the field, advance communications. So, are you still working with the Global Lyme Alliance?
Yes, so I still am their weekly blogger. I'm the voice behind the blogs and have been doing that for over a decade now, and really enjoy, writing for them and, all the work that they're doing to help promote Lyme disease awareness. And, just grateful to be part of that and to be able to, include the patient narrative, the patient voice in the work that they do. And 10% of the proceeds of my book, One Tick Stop the Clock, will go to Global Lyme Alliance and the great work that they're doing.
Yeah, I'm a blogger too, and I've been doing that for 10 years. So I'm more from a doctor's perspective, what I've seen in my patients. And so it's interesting when I read this book to see it the opposite perspective from you and that role as a patient. Now, is there anything else you wanted to share about the book or your experiences that with the audience that have been kind enough to stay with us during this program?
Um, just that my hope in writing and sharing the book is that it will give inspiration to people, that it will serve as a, beacon of hope, a beacon of inspiration, that you too can do it, that you too can refocus your life, refocus broken dreams, learn to thrive in the context of chronic illness. And, I think for many of us, there is no going back to our pre-Lyme life, but there is opportunity to really, really move forward well. And I really hope that my story can give people inspiration for that.
Okay, well, the book that we're talking about today is called One Tick Stop the Clock, a memoir by Jennifer Crystal. It's by Legacy Book Press, LLC, Kamachi, and I will be posting it in the comments section below the links to get the book. I'm sure it's in Amazon and other locations and available. So I know that you're having another or several other encounters with people. So it's nice that you can not only have a book, but be out there and sharing this story and what you've experienced with others in the community.
Thank you. Yeah, that's my hope, and I'm just excited to connect with others through this story.
So thank you very much. I'm going to sign off and thanks again. So have a good
Thank you
evening.
very much.
You're welcome. Bye bye.
Thank you for having me.